Hello, my name is Adam Riedel. This is my BSN205 Ambulating with a Gait Belt video. What you need for this is a patient, a gait belt, some non-slip shoes, and either some soap and water or some hand sanitizer. So to start off, I'm going to knock on the door and explain the procedure to the patient. Knock, knock. Good morning, my name is Adam Riedel. I'm going to be your nurse. Can we start off by verifying your name and your birthday?
Amy Riedel, 21093.
Good morning, Amy. I'm going to be helping you with walking around with some assistance with this gait belt here. It's going to just go on your waist. It's just going to help me make sure that you're secured while we're walking around. I saw in your EHR that you have some right-sided weakness. Is that true? Mm-hmm. Okay. So what we're going to do is put on some non-slip shoes on her. She already has some on, so we're just going to have them stay on. Those right there. And then I'm going to use a little bit of hand sanitizer. A lot of hand sanitizer. So Amy, I'm going to begin by placing this belt on the back side of you. I'm going to make sure that there's no twists in the belt or anything like that that might increase your risk of skin breakdown or tears. We'll start on the bottom here, or the back, and then I'm going to pull that side. I'm going to give myself a little bit more slack here, and then the tail end is going to go back into the side with the teeth, going towards myself, making it tight, and I want to make sure that it's snug, but it's not too tight on her. And I'm going to have the clip at the center of the front of her here, and I want to have about 2 fingers can go in rather comfortably, so that's tight, but it's not too tight on her. Is that hurting you at all, Amy?
No.
And then the rest of it just goes back into the clip here. With this little bit of extra, it's, it just falls to the side. Well, a lot of times in the clinical setting, you'll see them putting this inside, kind of tucking it into the belt. That's fine. Just be aware with older, frailer people that you might be increasing risk of tearing, so just make sure that that's not poking down, tearing their skin. So Amy, what we're going to do is I'm going to stay on this side when you do stand up. To get you to stand up, we're going to go 3 times, leaning forward and backwards, and on that third lean, you're going to go all the way up in a standing position, and then you're going to stand there for a second, acclimate yourself to getting up, okay? Mm-hmm. So I'm going to be on either side of you. I'm going to have proper lifting technique, and we're going to go 1, 2, and 3, and we're up. And I'm just going to have you stand there for a second. Does that feel okay?
Yep.
All right, and so since this is our weaker side, I'm going to have one of my arms on the back of the gait belt and my other hand on her, and we're going to do a little bit of walking. And when you're walking, Amy, it's important to have your head forward and have your one leg in front of the other, and I'm just going to match your paces here. All right. Do a little turning. Nice job. Good. And then just to stand, turn, and go back, and there we are. And I'll just remove your non-slip shoes, but I think you said you wanted to keep those on. When I take this off, I'm going to note for any potential skin breakdowns, but we didn't make any because we did this properly. And get her more comfortable in her chair. Are you comfortable how you are right now, ma'am?
Yep.
All right. And then before I leave, I'm going to use a little bit of hand sanitizer and document that we did some walking around with assistance in her EHR. Thank you.